Hello again. So I'd like to make a quick follow-up actually to my previous video about the importance of sleep for brain function. We talked about how it clears the beta amyloid and how it leads to a lower production of it as well, preventing it from accumulating in the first place, as well as how it allows to have more energy via regenerating and replenishing your mitochondria, right? By literally recycling damaged components and organelles, and how it improves insulin sensitivity and how it's so important for repair via the production of growth hormone. And I just want to point out, sleep is so important because without it, you increase a whole other, you increase your risk for a whole variety of chronic disease like diabetes, cardiovascular disease, and obesity, all of which are risk factors for Alzheimer's as well. And so you really want to address it. If you get poor sleep, your cravings also go up for things like unhealthy fats, which are like trans fats, and sugars, which are both obviously very inflammatory and increase your risk for Alzheimer's even further. Last video I talked about something called sleep apnea, which of course is not good because you're not going to get quality sleep. In sleep apnea, people literally wake up because they need to breathe. They cannot breathe, and so they literally wake up throughout the night to get a breath in. And you can imagine how that will reduce your quality of sleep. Your breathing literally periodically stops if you have sleep apnea. So you wake up during the night, sometimes even several times, and that can negatively affect your sleep quality. So sleep apnea is a condition that you want to address. And people that are in a higher risk are usually people who snore. So if you snore, you want to get tested for sleep apnea. Also, if you're a bit older, if you're like a middle-aged or older male, you're at higher risk for sleep apnea. If you're overweight, if you have like a short and thick neck, you're also at risk for sleep apnea. And if you're tired or a high level of fatigue during the day also makes you more likely to have sleep apnea, because maybe that's causing you to not get enough sleep, so you feel not refreshed and tired throughout the day. So if you have any of those, especially if you snore, and if you're a middle-aged man, then you probably should get tested. And I right now think that my dad should probably get tested for sleep apnea, because he meets both of those conditions. And poor sleep, of course, makes you tired and increases your risk for all type of problems, including poor brain function. So what you want to do is you want to get tested. And it's interesting because 75% of patients are underdiagnosed. And the reason is because to get evaluated, it costs around, especially, in the US, around $3,000 to stay overnight at a hospital sleep center to get tested for sleep apnea. And most people just don't want to do it. And that's why there's such a high percentage of patients that are underdiagnosed with this condition, with sleep apnea, and how that obviously increases your risk for getting Alzheimer's disease. Even if you don't have the gene for Alzheimer's, you're still increasing the risk so much by having elevated levels of beta amyloid, and of course having crappy mitochondria, which of course makes you tired throughout the day, all of which are not good for proper brain function. So make sure that you actually get tested. There is this test, it's called the AHI, apnea hypopnea index, which is the number of times per hour that you have stopped or nearly stopped breathing, right? The number of times each hour that you literally stopped or very close to stop or nearly stopped breathing. And some people may have this AHI of 100, but normal is fewer than 5, and the target is obviously 0. So if you have a very, very high number, then you should definitely test it. You should have an AHI index of fewer than 5 events per hour, and preferably 0. And so this is really, really important. And so this is how you can get evaluated. This is what they do to evaluate you, right? They determine how much time you stop breathing every hour, and the goal is to get it as close to zero, preferably zero. So do get tested for sleep apnea, because sleep is huge for proper brain function. And so that's really, really important. And there's also something called the upper airway resistance syndrome, which can literally mimic sleep apnea. That is not yet detected, right? So again, your practitioner can refer you for different tests to look at upper airway resistance syndrome. So this is when you actually get tested negative for sleep apnea, but you still fall asleep frequently throughout the night. So you have sleep apnea, but you're able to sleep. Well, you may still have upper airway problems, and you should still do, you should still get tested for a different test, like a sleep study, for example, where they use an esophageal pressure monitor or a sensitive pulse oximetry study. And so you can use those things for that. So do get tested at a hospital sleep center for sleep apnea. And then even if you get tested negative for sleep apnea, you may still have an upper airway resistance syndrome. So you should still get tested from a sleep study for that as well, where they look at the esophageal pressure, and they look at your pulse oximetry to test for that as well in the sleep study. So again, these underlying sleep conditions like sleep apnea and UARS, upper airway resistance syndromes, are a problem, because even if you were to do all the sleep hygiene strategies that I outlined in the previous video, you're still not going to be able to sleep, because you're waking up very frequently throughout the night, as in the case with sleep apnea, or you aren't getting enough air because you have resistance in the upper airway, also can hinder sleep and prevent you from getting high quality sleep. So do get tested.